My name is Mark Freese. I'm the CEO and founder of Wellview, and our focus at Wellview is to build a patient engagement platform. The problem that we're really trying to solve is the fact that globally there are 20 million deaths that occur every year, largely due to a lack of information. And so there's a tremendous opportunity to provide information that empowers patients. I think one headline that captured it for me, the vision of Wellview, was Dave Chase, who said, "The empowered patient is the next blockbuster drug." And so our goal at Wellview is really being able to provide information to individuals in developed and developing countries that allows them to make better decisions about their health care. And Wellview's vision is long-term to impact 1 billion people with information that can help them make improved decisions and hopefully save some of those 20 million lives that are currently being lost due to a lack of information. And so that's our broadest vision. In the meantime, we're developing a patient engagement platform and some early stage apps to test the hypothesis that providing specific information to individuals is meaningful and valuable. Someone will use it, someone will pay for it, and in doing so we can start taking additional steps to reach a much broader audience and provide much more information to those who need it. We are at the early stages of that. We're building a foundation that allows us to distribute across platforms. We're developing initially for the iOS Apple platform. We're just beginning Android development and web development. So we believe that it's a multi-platform solution, not just mobile technologies, although certainly the growth of mobile technologies around the world allows you to reach a much broader population than ever could have been possible in the past, where you might have had to have access to, in India, for example, have access to the entire Indian government or a very large NGO or a Bollywood movie to really reach millions and millions of individuals. But through mobile technology today, with a couple of the right relationships with the right carriers, and if you're bringing information and content that's meaningful, you can reach a huge population, and that's the goal. So certainly developing for mobile platforms, but also recognizing that the web, the mobile web, other technologies are really important to provide a comprehensive service that people can use. I think the impact that counts is, at the end of the day, you're providing in a health sense, a wellness sense. Are you providing information that ultimately leads to folks making a better decision? So if you're really looking at change that counts, does it ultimately result in people being healthier and happier because of the changes that they've made in their life? And that means that the information that we're receiving, we believe, has to be one accurate, informational, educational, and then specific and targeted at them, not just generic one-size-fits-all content, but can we create patient-specific content that allows them to understand their health better, and in understanding they go from receiving data to information to knowledge and then wisdom that helps them make better decisions. And we think that that change that counts allows not only developed countries, but in developing countries, the ability to reach individuals with information that helps them make better decisions. And in doing so, they ultimately are able to make life changes that help them live longer lives, take care of themselves and their family in meaningful ways, and ultimately improve their communities, their economic development of their countries, their family, etc. We think that's where global mobile health can make an impact that really counts. Again, you just have this tremendous reach to 900 million, approaching 1 billion mobile subscribers, where you've got, in certain locations, you've got mobile phones where there aren't toilets or toothbrushes. I mean, you really have access to individuals who never have had a personal screen to access information. Maybe there was a family television, maybe even a family computer, but now you've got a personal screen that allows them to access health information that's very personal and specific to them. The ability to reach those individuals in rural communities and urban communities with information that they never had previously allows them to understand conditions, allows them to make decisions, allows them to be empowered to manage their health in a meaningful way. And I think that mobile health just opens up opportunities that we've never seen around the world. I mean, India really has leapfrogged and skipped an entire generation of landline connections for phones and internet connections, and it's gone 100% mobile driven and cell tower driven, and the ability to make that leap. I think there's even reverse innovation, things that we'll learn in the US and in developed countries from what India is doing ahead of everybody else. And so I think it's a tremendous opportunity to learn and provide solutions to individuals that never could have received them otherwise. And I think I think we're just at the early stages of really having an appreciation for where mobile can take us. Largely, you've got 90% SMS text phones in India in the next 5 to 10 years. As you see a smartphone revolution occurring, and 4G connections in Kolkata, what's going to happen when the entire country is 4G enabled with smartphones? I think you're going to see a tremendous surge in the information that can be delivered and the way that people can use that information to better their lives. I think we're just really at the beginning stages of what can happen in India and across the world with mobile and health technology.